Vision at OPM. Good to have everyone with us. Just a couple housekeeping reminders at the top. One, that CTN is broadcasting today's Tobacco and Health Trust Fund board meeting. And two, in addition to CTN carrying the event, we are also recording today's meeting. So I would ask that if people can kindly introduce themselves and state their name when they speak, and when they're not planning to speak, let's go on mute so that we don't have a lot of background noise. That'll help folks following at home or watching this recording to be able to follow the conversation in a respectful, meaningful way. So with that, it is 10:33 and we have called this meeting to order. I would have the exciting news to share with the board that we have added 2 new trustees to the Tobacco and Health Trust Fund Board. The first is Dr. Samuel Hahn. For those of you that attended our last meeting, you'll recall that Dr. Hahn was good enough to join as a member of the public so that he was fully caught up on the allocation process that we're going to be formally voting on today. Dr. Hahn is the appointee of Senate Minority Leader Stephen Hardin, and is an interventional cardiologist. He also serves as Associate Director of the Cardiac Catheterization Lab at Yale New Haven Hospital. So it's excellent to have Dr. Hahn with us. And I have to credit and assist to Representative Harrison, who was good at recruiting him and making sure that he was formally appointed to this board. Second, we have Stephen Hernandez. I've had the great pleasure of working with Stephen in multiple capacities, including my time when I was at AARP. Now, most recently, in our time at OPM, Stephen has taken over as the executive director of CONCAN. It's a nonprofit advocacy organization committed to ensuring that students in Connecticut have access to high quality education. Prior to that, Stephen led as an executive director the Office of Women, Children, Seniors, and Equity and Opportunity. And I know he did tremendous work with the legislature in that capacity. He is the appointee of House Majority Leader Jason Rojas. I'll pause and give both of our new members a moment if they want to add anything of their interests in this board and any of the excitement or nervousness they bring in their first official meeting. So Dr. Hahn, you first.
Well, I wanted to thank the board and Representative Harrison. This is my first foray into public service in the government, so I'm very excited to actually participate from both the physician and as a member of the public. And obviously, smoking cessation and not only related to tobacco, but obviously it's very important to what I do on a day-to-day basis. So I'm very excited. So thank you all for having me.
Great. Welcome, Dr. Hahn. Stephen.
Thank you so much, Mr. Chair, and of course, gratitude to Majority Leader Jason Rojas for his trust in serving on this august board. I'll tell you, there's a legacy here, of course, of harm, of peril, of lack of education and information that no amount of resources could ever truly and meaningfully address. But the fact that we have this body, that we have these resources, and that we are committed to ever confronting what are ever emerging perils that face kids and face our families. I'm really grateful to be here with each of you and grateful for the work that each of you do. So thank you again.
Great. Regrettably, it's not all happy news on the front of our membership. We are unfortunately losing one of our colleagues, Deputy Commissioner Jody Terranova from the Department of Public Health. She has accepted a fantastic position and I know will be continuing in state service as the medical director at Department of Social Services now. But DC Terranova, we owe you a debt of gratitude. One, for being an incredible partner at reconstituting the board, helping to identify the talented people that are part of our board, and helping to navigate us understanding the best CDC practices and making sure that we were paying respect to those CDC best practices and formulating our allocation plans, both the one that was formally submitted and approved for the FY23 funding and the one that we hope to formally approve today at the end of our meeting. Deputy Commissioner Terranova, I'll just turn it to you for a moment to say I'm sad to lose you at DPH. Happy you're still in public service and in the Health and Human Services world, and just wanted to publicly thank you for the work you've done on the board and the future work you'll do carrying this mission to DSS.
Thanks, Claudio. It has been a pleasure to work with you on this board and all of the members. I've learned a lot. I know you said I've, shared some things and helped to lead the board through the process, but I also learned a lot myself, and I really appreciate that. I am staying in state service and moving over to be the medical director for Medicaid, so getting a little bit more back to my clinical roots as a physician and using that knowledge and expertise to continue to serve the underserved of our state, which is really my passion. So I'm sure we'll still be connected in many ways. I'll still be connected with my colleagues at DPH and really trying to help build bridges between the agencies because there is a ton of overlapping work. And so I encourage any of you to reach out to me at any time that I can be of any help or assistance. And thank you for this opportunity to serve on the Tobacco and Health Trust Fund Board.
Thank you, Deputy Commissioner. So with that, that formally sort of ends our introductions to today, and I want to ask Melissa to take roll so that we can confirm the quorum. I know we have plenty of individuals here, and we will be able to take action and votes this morning. But Melissa, if you'll just take attendance at today's meeting.
Sure. Claudio Gualteri.
Here.
Robert Boris.
Here.
Parisa Charmchi Goodwin. Aisha Clark.
Here.
Ann Foley.
I'm here.
Samuel Hahn.
Here.
Tony Harp.
Here.
Representative Cindy Harrison.
Here.
Stephen Hernandez.
Here.
Suchitra Krishan Saren.
Here.
Matthew Jasinski.
Here.
Christopher Moran.
Here.
Michael Rell. Thought I saw Michael.
Oh, sorry. Here.
Okay, thanks. Trisha Orozco.
Here.
Andrew Solner.
Here.
And Jody Terranova.
I'm here.
Thank you.
Great. So that brings us to the next item of housekeeping, number 3 on our agenda, which is actually number 2, which is to adopt the July 24th meeting minutes. Everyone should have received the meeting minutes, the draft minutes in advance of today's meeting. I hope you had an opportunity to review them. I'll entertain a motion and then any discussion if there's any edits or corrections, and then we'll move to a formal vote. Do I have a motion to approve? Dr. Salner, thank you. Motion on the table. Is there a second?
Second.
Second by Representative Harrison. Thank you. Any discussion, edits, or modification needed to the draft minutes of July 24th? Seeing none, Melissa, do you want to take a quick roll call vote on adoption of the minutes?
Roll call vote, sure. Hang on. Okay. Sorry, I just closed the attendance list. I apologize. I didn't know we were going to roll call.
Can we do we can do a voice vote? Sure.
Yeah.
All those in favor of approval of the minutes, please signal by saying aye. Aye.
Aye.
Any opposed? Abstentions? Seeing none, so ordered. Next item.
I think I just need an abstention from Stephen Hernandez and Samuel Hahn.
I abstain.
I abstain
Thank
as well.
Thank you. All right, now we're good.
The next item on our agenda is just a quick review of the goals of today's meeting, and I want to preview the agenda and one last minute change for the board. First, the change due to an unexpected scheduling conflict. Sarju Shah is no longer able to present on the annual Jewel report to the board. She has asked if we can hold the item over to our next board meeting. So we'll carry that forward. to our first meeting in 2025 and have a full report on the Juul annual reporting to the board. The other items of today's business, just to quickly preview them, we are going to review the FY24 allocation plan. The board did recommend and vote on top line distribution of the funding at our last meeting. You then received a draft copy of the formal submission plan. Melissa sent that out to the board members, and we'll review that in more detail and take a formal vote and transmit that at the end of October. The second purpose of today's meeting is to adopt our 2025 meeting calendar agenda. So when we'll be meeting in 2025. This is our last meeting of 24, so we want to formally approve our meeting dates for 2025. It looked like on quick scan, none of them conflict with major holidays or other times when we may have attendance issues. Finally, we'll have a brief update from DC Terra Nova on the RFP process and any next steps. So the approved plan for FY23 has been put in motion, and she can share with us some updates. In fact, I think we'll start with that last item, if you're okay, Deputy Commissioner Terra Nova, and then we can kick it into the more conversational pieces of the agenda. So I'll turn it over to you for an update on the RFP process.
Great. Thanks, Claudio. So everyone will be happy to know that the RFP is out there. It was released September 12th. And we received so far 7 letters of interest. They're due tomorrow, so we may get a few more in. And we put out an opportunity for any interested applicants to submit questions, and we supplied answers earlier this month. There were over 40 questions that were submitted about the process, and so we addressed those, and those are posted on the website as well. And then the next Friday, November 1st, is when all of the proposals will be due. And then shortly after that, our RFP review panel, which includes members of this board, will be meeting to go over all of the applications and select the chosen ones. And then we'll start working on contracts and being able to get those executed in the coming months. So things are moving along. And so hopefully we will have more information at the next meeting and really be ready to get this money out into the groups that will be doing all of this great work.
Great. Thank you, Deputy Commissioner Terra Nova. One quick question from me, and then I'll turn it if other board members have questions. You said there were 7 letters of interest. In any of the letters of interest, do they indicate a proposed budget or dollar amount? I'm trying to get a sense, if you know yet, of the 12 million we've allocated, what is the expectation for how much will be allocated through this RFP process, or if we'll have a sizable lapse returned for a second RFP?
I don't know. I haven't seen the actual letters myself. I can check with staff while we're in this meeting and see if I can get an answer for you. There were many questions that were submitted for the Q&A that were related to the budget and kind of how the money might be distributed. And so I think, our responses where it really depends on the number of applicants and then what the proposals look like as far as how we would be dispersing that money. But I'll see if I can get an answer to you in the next little bit and give you an update later in the meeting.
Thank you so much.
Sure.
Board members have any questions about the process underway through DPH for the RFP? Yes, Stephen.
Thank you, Mr. Chair. I'm wondering if there's still availability to volunteer for the review panel, if there is a need for that.
I'll check with Allison. She's been leading it, and I will see. I think actually that might be helpful because I think they were having trouble finding dates for everyone. So an extra person may quite be helpful. So yeah, I will find out and I'll get back to you later today. Thank you for volunteering.
Yes, on your first day on the board. We appreciate that. Love that enthusiasm. Any other questions from board members? Seeing none, we'll move to our next agenda item, which is a discussion and vote to adopt the 2024 allocation plan. Just to sort of level set again where we are in this process. At the July meeting, the board did vote on the allocation breakdowns for the funds. On October 17th, everyone had received a copy of the revised written allocation plan. That was the basis for feedback, and any commentary that you wanted to send to me and Melissa. We'll also use that as the basis for discussing today's review and formal approval. The one note I want to make is that the board had asked at a previous meeting to make sure that we were reflecting all interest earned to date, so that this next allocation plan is going to be more than the 12 million we received. It will include the 12 million that was deposited in April, but also any interest accrued through September. And so that resulted in an increase in our total amount that we can allocate. The total amount was adjusted upward to $14,394,776. That increase was distributed proportionately across the CDC best practice categories in the formula that the board had previously approved. I'll now introduce Melissa Morton to walk us through the plan and take any questions and comments. Melissa?
Sure. Thanks so much, Claudio. And as Claudio indicated, I hope you all received the report and were able to look through it. It should look very familiar. Much of it, because we have not entered into contracts and been able to get any new programs up and off the ground since we submitted the first allocation plan in April of 2024. Other than dollar amounts, it looks very similar. And that the report in general starts off with giving a review of our statutory authority, and then moves into how the board recommended disbursement for 2023. And I will try to do a quick screen share because this is the one section of the report that is a little bit different, since it actually provides an update here where we tried to capture what was approved by the legislature for our 2023 funding. We broke down how we held to the CDC distribution allocation amounts and what that looked like for our total authorized amount of $12 million. And then just provided a funding distribution status update just to let the committees of cognizance know where we are with our last, with dispersing our last allotment of funds. So just indicating where a competitive bid process is underway and what has been utilized for funding so far for example, that the $500,000 that we earmarked for the quit line has gone to them, and that DPH has received the funding, the $525,000 for infrastructure and administration that they're actually using to hire staff to administer the Tobacco and Health Trust Fund contracts resulting from the RFP process. So this chart here is a quick snapshot. And then we just get into a little more detail where we were able to explain that what we're actually, DPH is actually doing with the funding, and breaking it down to allow the committees of cognizance to understand who DPH is hiring, that they're hiring a health program associate, and that they're onboarding the new person in the late fall. And so we should have somebody up and running and what those job duties look like, so that there's a clear understanding of what we're doing with those administrative dollars. Any questions on that section before I keep going? Okay. I'm sorry, it's hard for me to, I can't see everybody, so y'all have to speak up if you have questions. So then we get into what we voted on in July 2024 about keeping our purpose of the trust fund and our board priorities as they are in statute, that we're holding firm, that we're not adding any additional priorities until we have evidence to support adding priorities beyond the ones that are set forth in statute for the board. And then an explanation of our 2024 disbursement proposal. Here we get into the explanation of sticking with the CDC percentages, but first taking $2 million right off the top to fund our benchmark our cornerstone program, Quitline, so that we can ensure consistency over a total 5-year period by giving them $2 million right off the top. They have the year that from the last allocation and then the $2 million to carry them another 4 years. And that the board felt was very important to have an interrupting funding stream that allows for planning and that provides stability to this evidence-based and highly effective program that has really been the cornerstone of the board's work. And also it allows referral sources, physicians, community partners, and people who call the Quitline to have to know that the resource isn't going to go away. And I know Representative Harrison wanted to make sure that we were never again in a position where we were stretching our dollars to keep Quitline funding going, that we had to reduce the amount of cessation products that were available to callers and maintain that 8-week supply and not have to reduce below that. So what this is where you're going to see the change. I know we originally voted on a budget of 14.2 million that we knew was estimated because we were waiting for the interest to post and clear. So we used the exact same funding formula that was used when we calculated the 14.2 million total allocation amount, but now, due to having that additional little bump of 167,000 extra dollars, this chart was refreshed to show the 14.3 million available to the board for allocation. And again, same formula used, 2 million taken off the top and then the CDC percentages applied and to the remaining balance. And this is what it ends up looking like for percentage of total allocation breakdown. And then the rest of the report, again, very, very familiar, where we just went section by section for each of the CDC categories, explained how much we're allocating, and the language remains pretty much the same from the last allocation proposal, where we go into how the funding was used in these categories in past rounds. And again, the one place where you would see a change, a significant change from our last allocation plan in April, would be cessation and intervention, where we just go into refreshing the Quitline numbers. We have some more updated data on the effectiveness and number of users of the Quitline. We reference the change in vendor from RVO Health to the National Jewish Health, and we explain in a little more detail why the board chose to take the $2 million off the top. And that is what is in the report, and I'm happy to answer any questions.
Great. I think we have, Melissa, thank you for that overview. I also just want to thank you and all the people on the board for just quickly turning around this second allocation plan. I think when we presented our first, the legislature had clearly signaled to us an interest to get on a more timely cycle and get caught up. There was a backlog in standing up the board and getting those allocations out. We also get our disbursement from the tobacco money at the end of the fiscal year, towards the end of the fiscal year in April. So you all did incredible work catching us up. And with our vote today, when we formally approve this and transmit it by the end of the month, we will have met both the Public Health Chairs and Appropriations Committee Chairs' request and leadership of all committee, both rankings and chairs, to get these back on a normal cycle and get caught up with our money. And all this tobacco money will have been accounted for when the legislature formally approves our allocation plan. So thank you for that incredible work. Suchitra, I see your hand up, followed by Stephen for questions.
Yes, I want to echo what you said, Claudio. Thank you for all the work you all have put into this. I just have a quick question about one of the slides, one of the pieces you showed, Melissa. You talked about there's a competitive bidding process on for the state and community interventions and maybe another category. What is that? I'm sorry, I'm not familiar with that. What is the competitive bidding process for? Is that part of the RFP? Is that what you're talking about?
Yes.
Or okay.
The RFP process is the competitive bid process.
Okay.
That's correct.
But that
Yes.
applies to all the categories, right? Not just those two specific categories. It would apply to the cessation category too, because I didn't see it specified there.
Yep. It says competitive bid next to, and perhaps it'd be helpful for me to show it again. It says competitive bid next to every category except for, I believe, the admin.
Okay.
And the quit line, which we're dedicating.
Sure.
Right.
Okay.
And the rest is going to, so quit line, but cessation is still competitive bid, except that we're pulling $2 million, or at that, the slide you're talking about, we are pulling the 500,000 because this was 2023.
Sure.
So we took 500,000 off the top, and remaining funds are part of the competitive bid process, or the RFP process is yes.
Thank you.
You're very welcome.
Go ahead, Stephen.
Thank you. There's a section in the report or in the recommendation on surveillance and evaluation. And there's a note here where it says this is the same evaluation procedure used historically. Will that be part of the evaluation, or is there, and forgive me, this might be a newbie question, but is there an existing surveillance and evaluation system that you use?
Thanks. That's a really good question. So historically, the board had used those dollars to contract with a third-party evaluator to do the work of looking at the programs that were being funded with the Tobacco and Health Trust Fund dollars, to do an unbiased third-party evaluation to see what's effective and help inform allocations in the upcoming year. We are looking to adopt that same approach. That's what we mean when we're referencing historical, the prior iteration of the board. And so part of the current RFP process is to actually have somebody bid and find that third-party evaluator who will be able to look at the effectiveness of the programs that we're funding. You're welcome.
Any other questions from board members? If not, Melissa, let's do a formal roll call. Oh, no, sorry, Representative Harrison, sorry.
I can save this question for later. Do we, and maybe it's more appropriate for later, so stop me and I'll wait. But was wondering when we know this will be submitted to appropriations, but when they will take it up.
Good question, Representative Harrison. So the process as it is outlined in statute requires us to send this over, transmit it to both Public Health and Appropriations. They then have a 30-day period by which to hold a public meeting and vote on it. If they choose not to, they can decline to hold a public hearing and a meeting, and it would be deemed approved after that 30-day period. We anticipate after today just allowing for a brief period of time in case there were any typos or clarifying errors that we want to make sure to get in as tight shape as possible. Once that process concludes, we will send it over no later than October 31st. But definitely this month, and that will give the committees of cognizance the month of November to take it up and vote on it. We will also flag through our legislative team here at OPM that this is coming. So they have a little bit of advance notice through Sue Keene and through Bev Henry.
So perfect for that answer. And while, I still could be obviously notified, I think helpful for all of us to know when it's going to happen, because certainly some of us may want to be there. You do a wonderful job presenting, but it's always nice to have support.
Absolutely. We will do as we did last time. So, Melissa, when we formally transmit to the committees of cognizance, we'll include everyone on our listserv. So the board members and interested parties will get it at the same time. And then we will, once we know of a hearing date, we'll do like we did last time and pull out a few key bullet points so that if members of the board wish to submit written testimony or attend or just in separate conversations, advocate support, certainly welcome that. And we'll also share the written testimony that OPM puts in, and typically DPH does as well. Obviously, we have a transition with DC Terra Nova, but we'll coordinate with DPH and share any written testimony that we submit in advance that may be helpful.
So thank you for the answer, and I think that's good for the new members of our board to know. So thank you.
Great. So with that and seeing no further questions, we'll take the roll on approval of the 24 tobacco allocation plan as submitted and discussed here this morning. Melissa?
Okay. Claudio Gualtieri.
Aye.
Robert Boris.
Yes.
Aisha Clark.
Yes.
Ann Foley.
Yes.
Samuel Hahn. Tony Harp. We'll go back to Dr. Hahn. Tony
Yes.
Harp. Representative Harrison. Okay. Stephen Hernandez.
Yes.
Suchitra Krishan Sarin.
Yes.
Matthew Jasinski.
Yes.
Christopher Moran.
Yes.
Michael Rell.
Aye.
Tricia Orozco.
Yes.
Andrew Salner.
Yes.
Deputy Commissioner Jody Terranova.
Yes.
And we'll try one more time. Dr. Samuel Hahn. Okay.
Did you get me, Melissa? I'm a yes, obviously.
Yes, I heard you. Thank you so much, Representative. Okay, Claudio, it passes.
So with that, unanimous approval. Congratulations, everyone. Good work. The next item is agenda item number 7, which is reviewing the 2025 meeting schedule and a vote to approve those dates. Melissa, if I can ask you to screen share just so that everyone has those dates and can start penciling them in on their calendar while we entertain a motion to approve them. So these are the dates which represent 90 minutes, quarterly meetings, 10:30 to noon on the 4th Wednesday of January, April, July, and October. Do I have a motion to approve the 2025 meeting schedule?
I'll make a motion.
Who was that?
Sorry, I heard 2 people at once. Melissa, did you get the motion?
I did not. I would love to know whose voice that was. That'd be great.
Trisha Orozco.
Oh,
Okay,
thanks,
Trisha.
Trisha.
To
And
approve.
Chris
the-
Moran, I'll second it.
Okay.
Great. Thank you, Chris.
Great. Motion is made and seconded. Any discussion on the meeting schedule? If not, let's take a voice vote to approve the schedule. All those in favor, please signal by saying aye. Aye.
Aye.
Aye.
Opposed? Any abstentions? So ordered. That brings us to the next item, which is just a quick discussion on next steps and where we go from here. and I thank Representative Harrison for allowing me to preview this earlier. So in terms of the allocation plan, we will now be formally codifying it, cleaning up any technical errors, and transmitting that to the committees of cognizance, which sets off a 30-day period for them to convene a hearing and a committee vote on approval. We will also be planning to meet in January to kick off our 2025 schedule. At that meeting, we will provide the board with any updates on the approval process of our 24 plan and disbursement of funds up to that point. So we'll have a continued update of the RFP process through DPH, what we know at that point, and whether hopefully the committees of cognizance approve this 25 plan. We'll also get a presentation from the quit line provider. I thought it was helpful knowing that that's going to be one of our ongoing cessation intervention and programs, that we would have them and the board members can ask questions and understand some of the new features that they've been able to embed into the quit line service. We'll also close out with any updates in terms of the RFP process for 2023 and when the evaluation committee is meeting and what the next steps may be on awarding contracts, including the total dollar amount that we could expect to be allocated as a result of that process. Any other items that board members wish for us to consider for the January meeting? Tony Harp.
Yeah, it's not related to the question you just asked, but I was wondering, with the evaluation committee, will they be making a formal report to us in terms of evaluating every budget item that we've approved, including every budget item that we've approved, so that we'll know exactly the impact of everything that we approved previously? I'm assuming that there was a previous grant period, maybe not, but if so, will they be doing that, I guess is what I'm asking, and then will they be reporting back to this group?
So I can start and then I'll tip to you, DC Terranova, if I could. So one, my expectation is that once the RFP process concludes and the evaluation committee that's staffed by DPH awards the contracts for each of the categories, that we'll have a breakdown of where dollars were awarded and under which bucket of our allocation plan those dollars came from. And then separately from that, my hope is that one of those buckets will secure for us an independent evaluator that then will serve as technical assistance for this board in looking at each of the interventions that we fund. What has been the ROI? How have the dollars been used? What has been the impact? What is the scalability or recommendations for refinement of that intervention? DC Terranova, do you want to add any more about the nuts and bolts of the process?
Yeah, I think that was perfect. I don't know, Tony, did you have any follow-up from what, or clarification needed from what Claudio just said?
Well, I guess in some respects, it would be interesting to look at that as compared to sort of public health goals and outcomes. And I don't know whether or not that's what, I mean, not if that wasn't planned, fine. I just wondered if it was.
I think that the organization that we contract with to do the long-term surveillance and evaluation will do exactly that process and be looking at the public health goals, looking at the CDC goals, our own internal goals at DPH, and the board goals, and be able to provide feedback on all of those to see what we're achieving and where there might be gaps. Because I think as this board moves forward, we may decide to allocate money differently based on the information that we're getting from the evaluation.
Thank you.
Sure.
Any further comments? If not, I'll turn to our opportunity for public comment. There are a few members of the public that have joined us today, and I want to pause. We did not receive any written public comment in advance, but if anyone from the public wishes to speak, if they could just raise their hand or come off of mute and let us know that you have an interest in making a comment. Representative McCarthy-Vahey.
Thank you, Claudio. I would love to just echo the thanks to all of you for the work. Some of you may recall my comments at the spring meeting. I appreciate you all staying on top of this, keeping this moving, and doing this really critical work. I did want to express that as the co-chair of public health, I will absolutely be interested in a hearing process for this as opposed to just the deemed approved. I believe, I can't speak for my other fellow leaders, but that's certainly what I expect. I also, just for purposes of helping to assure that we can have a timely meeting, I will actually reach out to our committee administrator today. I know that there's a formal process, but we'll start to look for those dates and together with the appropriations committee starting today.
Excellent. Thanks for your ongoing support and for your help with the approval process and the vetting process at the legislature. Any other public comments? If not, that brings us to our last item, which is a motion for adjournment. Oh, DC Turnover, did you have a comment?
I was just going to I just put it up. I was just going to provide an answer to your question earlier about the letters of intent. So they do not provide any budget information in those. They just give us a brief description of what they would like to do and which component they're interested in applying for. And late breaking news, we got a couple of more letters overnight. And so now we're actually up to 10, and we have at least one for each component. So I think we're in good shape, and we'll have more information in the next couple of weeks for everyone.
That's great news. Yeah. Thank you, Deputy Commissioner Terranova. So with that, the last item for us is a motion for adjournment. Do I have a motion? No one wants to leave this meeting. I love spending time with you too. Suchitra moved and Dr. Salner second. All those in favor, signal by saying aye. Aye. Have a good day, everyone. We are adjourned.
Thank you, Claudio.
Bye, everyone.
Thank you.